Next subject matter area is going to be community care and the different methods of community care. It's something that we touched upon in the SIM last year, and it's something that is at issue in our community as to what are the best approaches. Is it fact? Is it something else? So we have an expert here to discuss that, and many of you know him, but for those of you who don't, we have Mark Engelhardt. He is the director of Florida's Criminal Justice, Mental Health, and Substance Abuse Technical Assistance Center at USF. In that department that he is in specifically is the Mental Health Institute, the Department of Mental Health Law and Policy. Mr. Engelhardt facilitated the SIM process that I discussed with you and the product of that with the Sarasota County stakeholders in 2017. Mark has conducted several behavioral health care evaluations and training in Sarasota County over the past 12 years, so someone who's very familiar with our community. Mark has served on SAMHSA's Permanent Supportive Housing National Expert Panel to update the evidence-based toolkit, and he is a recognized international expert researcher and educator on Housing First. Please welcome Mr. Engelhardt.
Thanks, Judge. And you know, it's important to recognize other people. And is Kim in the room? Yeah, she's done a great job of tracking the sequential intercept mapping. And by the way, you saw that nice map up there. It's Karen Mann and Caitlin Helderson. You raise your hands. They're the ones who actually did the map. They work with us. Our Technical Assistance Center is 3 people and a whole lot of subject matter experts, okay? Since I got the floor, let me just mention a couple things. I know you saw Judge Leifman's video earlier, and there was a clip on Hillsborough County. And I'm very pleased to say that we were in the county jail 2 weeks ago. We toured the mental health unit, and it doesn't look anything like that today. So that's good news. It's really been very much improved. While we were there, the psychiatrists were there, the medical doctors were there. The inmates were doing fine. They were in treatment. That's not perfect, but it's come a real long way. I'll mention a couple other little things just about Sarasota County because history is important. I mean, where you've been and where you are now, it's a world difference in 10 years. I remember coming in 2007, Ed, and I spoke to the board of directors of the Suncoast Partnership. It was their annual board meeting, and they had this big board meeting over there, and the Community Foundation sponsors it. And I remember I came in as the so-called expert on Housing First at the time, and nobody wanted to hear it. They just didn't want to hear Housing First. And I'll talk a little bit about that later. What the audience didn't know is I had the founder of Housing First, Dr. Sam Sabreras, with me. So he was in the room watching, observing, seeing where this community is at. Another report that we did here, which is still relevant, is the Viper CART report. It was done about 11 years ago, and that was really a kind of a beginning. There's a couple of folks that you're going to remember. It was Chip Taylor and Bill Little. You probably both remember them. They were local heroes as far as I'm concerned, but their real thrust was how do we bring the providers together on a single project? So they actually had a forced advisory board, and it worked. People worked together. They actually work together. So it's just a little piece of history. The other thing I'm just going to mention, I know Judge Leifman's not here. I've known Steve for 16 years, and he mentioned that data report we did out in Miami. Well, a year and a half ago, the governor, the first time ever, the governor had an executive order on the mental health system. I don't know how many of you are aware of that, but what he ordered was the Department of Children and Families to do a study on 3 counties. It was Pinellas County, Broward County, and Alachua County. And our department was hired to do that study for them. So we did a very similar thing to what Judge Leifman explained. We did a crosswalk of data on those 3 counties, and those 3 counties specifically asked for this target population, people involved in the criminal justice system with mental health and substance use disorders. So that report is out. There's an executive summary, which is small, but if you really want to look at data and how robust the data is, there's 175 pages of data, if you want to really look at it, and what can be done when we have access to cross-systems data. Okay, so that report is out. It's all about coordination of care. The other thing I want to mention about that study, because it wasn't just about data, it was about talking to people. It was talking about the consumers, it was running focus groups, it was talking to providers, it was looking at case records. So the case record might say, person needs housing. Well, then you go into the case record and there's nothing about housing. They did a great job of identifying, but not delivering it. So there's a lot of things in that report you might find of interest in terms of coordination of care, because I know it's sort of a buzzword these days. So we'll move forward. What Judge Quartermain asked me to do is, when we first talked, hey, Mark, can you talk about a community care model? And back then it was like assertive community treatment or something like that, okay? It was like one or two models. So I kind of sat down and said, you know, we've been running this statewide technical assistance center for the past 12 years. We've been in 25 different counties. We've done 30 sequential intercept mappings. And by the way, the counties who follow up on their sequential intercept mappings are the one who have the most traction. You're one of them. I tell you, probably 10 of the 30 really have traction, where you got somebody hawking it, you're following it, you're delivering, you have champions. I love the word, you use the champions word, and you're following through. You're going to see results. I can name the other counties. I won't name them, but the sequential intercept mapping really is a very important thing. So, but anyhow, in thinking through this brief period of time, I said, well, what have we sort of observed in the last 10 years across Florida? Because we can all go online, look at the best practices. And by the way, many of our subject matter experts are truly national experts. I mean, Hank Stedman and Fred Osher, to name a couple, Ken Minkoff on co-occurring disorders. So those are our partners. So we kind of sat down and said, okay, well, let's take a look and let's just share our observations over the last 12 years of what's going on in Florida, a little bit of a roadmap. And this is kind of where I'm going to take you in the next 20 minutes maximum, okay? Sarasota County. I mean, without the leadership, without this reinvestment grant, I must say the reinvestment grant really, you already had traction, but the reinvestment grant really is a catalyst. It's a catalyst to a lot of counties. And by the way, how'd that grant start? I wish Steve was in the room, but it started at a Partners in Crisis meeting in 2006. It was a strategic planning meeting over in Orlando. We threw the word up on the wall, reinvestment, and it stuck. We got the legislation passed within 6 months in Florida, which is unheard of. The grant program started off as a $4 million non-recurring grant program. It is now a $9 million recurring grant. That's very important, because each year, as projects ends, there's going to be new money in the pot, okay? The other thing in writing the legislation is we gave counties a lot of flexibility. The idea was use evidence-based practices, but you know your community. You know the territory. At least work within some level of evidence-based practice and do what you need to do locally. So that's an important piece of that legislation. But anyhow, the other thing I think that was a turning point was the sequential intercept mapping throughout the state of Florida. DCF actually had the vision to put it in their request for application. So they really did encourage it across the state. The target population. This is a very focused target population. That's why I'm not here to talk about all homelessness or all people with serious mental illness. It is a very focused group. And by the way, one of the things I would encourage people to use is use person-first language if you can. People in the criminal justice system, people with mental illness, they're not chronically homeless. Veterans who are homeless, they're veterans first, they're people first, they're family members first. Their diagnosis is secondary. So I really encourage you to use people-first language. But anyhow, this target population really is people involved in the criminal justice system with serious mental illness and substance use disorders. If I wouldn't mind sharing a brief story, because our emails are public. I got an email one time from Judge Quartermain, and it was a very brief one. He said, my God, Mark, I got 25 people in this project. Am I serving the right people? 90% are homeless, they have a serious mental illness, and they got a co-occurring disorder. And I wrote back very simply, I said, absolutely you're serving the right people. It says right on target. So don't worry about your outcomes at this point. This was early on in the grant. And that's really important. When you got a judge that's not willing to cream people and take easy cases and stuff like that. Anyhow, so what other observations? One of the things is the whole screening and assessment. It isn't until like probably the last 5 years we've really seen much more emphasis on risk. And I'll go through a risk slide for you. Used to be, well, are they coming into jail? Are they mentally ill? What's going on with them? No. Now we're really looking at risk. Are they going to reoffend? Are they really going to wind up back in the jail? So the target population kind of changed just a little bit. The other piece is the in-jail identification. People in the jail, substance abuse and mental health providers, identifying people in the pods, who are they, and do they have a connection on the outside? And that the transition plan is extremely important. Every single county we've looked at is a different level of transition planning, from jail to community. Matter of fact, Judge Leifman just walked in. They want a reinvestment grant this year. Their focus this year is on transition planning. Cindy Schwartz, his staff member, we talked a couple weeks ago, that's the gap in their service, and that's where they're making a dent now. So every community is a little bit different. Quick example, Charlotte County had a grant a few years ago. Charlotte County concentrated on transition planning. Came out of the blue. Doesn't cost a whole lot of money, okay? And then obviously mental health courts, specialty courts is part of the roadmap, but it can't be done without collaboration from your community. I think your selection of Centerstone in the project, and I'll talk a little bit about that, was probably a very good selection, but they can't do it alone. They can't do it alone without Coastal. They can't do it without First Step and other providers. So they cannot go it alone. So we'll talk about assertive community treatment models, because really when you look at this target population, we're really talking about assertive community treatment, not linkages. Now, I know some communities have had success with linkages, referral into a network, warm handoffs, but when we talk about high utilizers, I hate to use that term, but people who use the system a lot, those are the folks who really need assertive community treatment. It's not here's a referral and go elsewhere. I remember early on in this program in Sarasota, that was the focus. By the way, the good news here, I interviewed the staff very briefly. They didn't know I was interviewing them. It was in the hallway. I asked them a simple question. How much time do you spend in the community? How much time do you spend at the person's home? And I don't know how many staff are here from that program, but the answer was from 70% to 90% of their time. Adina's here. That's phenomenal to spend that amount of time in the community. So they're on the right track. And then, of course, the last roadmap piece is the importance of supportive housing and employment, and we'll get to that. Congratulations to Vincent Academy here. It's incredible. The members are doing a great job. They're off to a terrific start. So let me go through a couple of other things, because, we talk about the criminal justice system a lot, and I'm going to share a story we did in Hillsborough County 15 years ago. They got a SAMHSA grant. The Substance Abuse and Mental Health Services Administration is SAMHSA. That's the only acronym I'm going to use. By the way, there are 2 grant possibilities available right now from SAMHSA. So if you're not going after them, you're not going to get them. One has to do with CIT provider models working together, and the other is a homeless treatment grant. Okay? So they're on the streets now. They are available. So one of the things that we wrote a memorandum of understanding about 15 years ago in Hillsborough, and I'll never forget, there must have been 15 lawyers looking at this memorandum of understanding. They said, well, what's all this language? This isn't legal language. I said, no, this is the principles of recovery. So what the judges signed off on, what the lawyers signed off on in the final analysis was these principles of recovery: hope, person-driven planning, nonlinear pathways to recovery, peer support, relationships and social networks, culturally based services, addressing trauma, and addressing people's strengths and responsibilities at the same time. And I think that went over pretty big with a lot of the judges and the lawyers. Oh, they have responsibility too? Of course they do. It's their responsibility. And of course, respect and encouragement. So this is actually an illegal MOU reviewed by many, many lawyers. Anyhow, so go ahead. The next one of our observations, quite frankly, in the past 12 years was, as I mentioned, the screening has become more and more important. It really has been. In terms of engagement of the individual, co-occurring disorders, there's the old phrase that Ken Minkoff came up with, it's the expectation, not the exception. So with this target population, we really are talking about 80%. It's not anecdotal. We have data around that, okay? And I see Marlene shaking her head, because if you're not a co-occurring capable provider, you're not able to give that person the right treatment. So, and that's everybody. Everybody ought to be co-occurring at some level, even just identification. And this is a clinical screening. This is unlike the screening I know the Homeless Coalition has. Ed will talk about that. There's lots of other screening tools, but this is clinical. This is when you get, your Dr. Taylors looking at folks, and you got your LCSWs, and they're looking at things, around the level of functioning, an actual diagnosis, although it may not be perfect, but it's done by a professional, so at least we've got a baseline, okay? Next one, please. So, in the last 5 years, what we've seen is a greater emphasis on the risk-need responsivity model. This model has taken off all over the country. We have a webinar on our website. Dr. Fred Osher does it. But basically, this has kind of changed the conversation because it used to, as I mentioned, it used to be all about mental health screening. So on your left here are the real high-risk factors. These are the ones nobody talked about before, okay? Antisocial attitudes. Individuals who really have no respect for the courts, have no respect for law, have no respect for police. Antisocial friends and peers, hanging out with the wrong crowd. You all know this, but we weren't screening for it, right? The antisocial personality pattern and substance abuse. The ones on the left-hand side, these are the high-risk factors that usually wind up when people get rearrested. The other side are important, but not what we found is not as important as the other risk factors. So family and marital problems, lack of education, pretty common with this target population. Poor employment history, very common. Lack of pro-social leisure activities. So what are these folks on the left doing? Well, they're not necessarily going to church every Sunday, right? They're hanging out in the park, smoking a little crack with maybe not their best friends, maybe somebody who's going to, beat them up or something. And then what's emerging, and by the way, this is not in the RNR model, but what is emerging is the whole area of trauma. I mean, it's clearly recognized now, and it should be in a screening tool. So let me talk about what the differences. I want to give you the differences between like 3 models, and I know this is part of your sequential intercept mapping. Assertive community treatment has been around since the 1970s, okay, for the civil population. I ran a program in 1986 in the heart of Washington, D.C., bringing people out of St. Elizabeth's Hospital. We know the research on ACT. ACT works since the 70s. The change has been, and let me just tell you what an ACT team is, for those of you who don't know what it is, okay? And then I only did one slide. I could do about a 3-hour presentation. And by the way, the National Alliance for Mental Illness has a whole book out on it, so family members have been supporting ACT. But it provides a certain level of support for this target population you normally don't get through regular case management, okay? It's not a linkage model. It's not a brokerage model. It's not a referral model. It's a team. It's an interdisciplinary team. And I'll show you the difference between this one and Centerstone's right now, okay? So if you look at the actual team, we're talking about a social worker, a nurse, a housing specialist, an employment specialist, a psychiatrist who does home visits, how novel, and housing is an integral part of an ACT team. So on the civil side, we've had ACT teams, and we have 32 ACT teams in Florida. And I'll make this comment. Those ACT teams all include Medicaid. They were built into the program. 32 teams, one of the highest appropriations in the state of Florida's behavioral health system. Well, I'll be honest, I think we need 32 FACT teams, forensic assertive community treatment. I don't know if Judge Leifman would agree with me. I hope he would. But I think almost every community in this state needs a much more intensive team. Now, they don't come cheap. But if you build Medicaid into the program, it's a lot less expensive, okay? By the way, that's how we differ. Florida differs from all of the other states who have Medicaid expansion. It is very easy for those states to roll their Medicaid into their programs. Talk to any mental health court judge in a Medicaid expansion state, and they'll tell you 90% of our individuals have treatment. Why? Because we have Medicaid. We heard earlier somebody said 90% of ours have no health insurance. Welcome to Florida. So, not a political statement, it's a fact. So, but my point is that's how you build an ACT team. Okay. Now, forensic assertive community treatment is a modification of the original ACT. And by the way, the original ACT has gone through 3 variations of fidelity tools. So we know how they're working. You actually apply the tool to the program, see how well they're doing. Florida, by the way, and the 32 teams have never been officially evaluated. They're doing well, we know they're doing well, but no official evaluation. So what's on the horizon? Well, it's kind of interesting because the research on FACT teams, Florida Assertive Community, there's some research. Hank Stedman did some, and a few others have done. There's a few articles, but it's not as robust as ACT. So I will tell you, this past week, SAMHSA announced that they are gathering a very large expert panel to look at forensic ACT. They're looking at the modifications, what works, what doesn't work. For example, including probation officers maybe on the team, including some boundary spanners on the criminal justice side on the team a little bit more. So there's a few other, the partnerships with the courts, looking a little closer at arrest rates versus recovery on the civil side. Community integration, social settings, peers, and of course, once again, permanent supportive housing is a core component of any FACT team, ACT team, or my next one, which is FUSE. So, the next one I'm going to share with you is, just forensic intensive case management. This is really the model that Centerstone is doing, okay? It's not a full-blown ACT team, fully funded with all the bells and whistles, with all the nursing and psychiatry staff. Yes, it has backup staff. But this is what basically, and there's a number of these in Florida, by the way, because this is what we can afford, okay? This is basically a modified ACT team. A lot of the principles are the same. Lots of time spent in the community, lots of outreach. Those principles are all the same. Nothing changes. But it's mostly case managers, nothing wrong, mostly social workers that may not have a substance abuse specialist on the team like a real full-blown ACT team does. It does case conferencing with the courts. I attended the one Judge Quartermain did. It was very, very well done, where they look at everybody who's coming through the court. And then the transition planning from the jail to the community is something that is being done. So you've got a forensic intensive case management team. It's excellent, it's working, but it's not as high standard as a full-blown forensic ACT team, okay? So it doesn't have some of the bells and whistles. Good example is housing. They depend on, Scott, they depend on others for their housing. It's not built into the core program. Employment, they're going to depend on Vincent Academy. They're not going to have an employment specialist on their team, okay? Therein lies the difference, okay? Not as much research, but there is some early research, okay? Next one. So, just to kind of give you a global perspective. So, what are the other best practices? I'm just naming a few. I only got 20 minutes, okay? And you guys know these, but I'm going to give you a couple observations, okay? Crisis intervention teams and providers by design. Can Sarasota County do a better job on CIT? Yeah, it's part of your sequential intercept mapping. You're trying to increase it. You're trying to make it better, right? There is a grant out there for a hybrid model with providers. There is some interest here in taking the transportation load off of the Sheriff's Department. And so it is a model out there. This isn't anything new, okay? So you got to go for it. The APIC model is assess, plan, identify, and coordinate. This model has been adopted by a lot of communities, including Miami. It's the APIC model. What it is, it's a model where everybody uses the same model. So Armour would use it. Centerstone would use it. Coastal would use it. Everybody's on the same sheet of paper when they're talking about assess and coordinate pre-discharge planning from the jail. The IPS, the Independent Placement and Support, is an employment model. It's the only evidence-based practice until last year in the SAMHSA toolkit. Last year, they unveiled the consumer-operated services. So I know already that Vincent Academy is looking at those two evidence-based models and seeing how they line up with your program. The principles, the practices. The IPS model has been around for a number of years. Bob Drake is a psychiatrist that basically ran that out of Dartmouth. All the research is around that. The consumer business model is a variety of models. It's not a single model. Okay, so I really do encourage Vincent Academy to look at the consumer-operated business one. You'll find some fascinating stuff, some entrepreneurial stuff, some peer run-up businesses, etc. The other thing, just in terms of housing, the Permanent Supportive Housing Toolkit from SAMHSA has been out. My challenge to you is use it. Use the toolkit. In the toolkit, it's more than just services. It's finance. There's a chapter on finance. There's a chapter on working with landlords. There's a chapter on planning. There's a chapter on working with your public housing authority. If I was to look at the public housing, the number of vouchers you have in Sarasota County and put them against the rest of the state, I hate to tell you what I'd find. They would not be as many because you missed it. There was a period of time about 8 or 9 years ago when the PHA just didn't apply. It just didn't, for whatever reason. There are lots of reasons. Go over to old St. Lucie County. I think they got 180 vouchers just in one county alone because they were there. They were going after them. But anyhow, so you have to apply to win this stuff, okay? Now, the other one, another emerging housing, is this FUSE model, which is pretty interesting. It's the Frequent User Service Enhancement model. This really comes out of the Corporation for Supportive Housing. They have a lot of, if I'm not mistaken, somebody's on their board of directors here. But they've got some early research. They've done it in New York, Chicago, a few other places. Once again, it's really not anything different than what we've been talking about, but they very specifically identify the target population. It's clearly people involved in the criminal justice system. And there is some early research on the FUSE model, okay? So I'm going to kind of wrap up. I just mentioned the Consumer Operated Services, which really is a range. And I'm going to kind of just wrap up on two things. Independent evaluation. And USF, we're not looking for any work, I can tell you. We got enough on our platter. But I do encourage you that as you move the SIM forward, you look to the outside, you look to an independent evaluator to do the gut check on the numbers, the data, the qualitative piece of this. Talk to the members, talk to the residents, do focus groups. When was the last time Sarasota County did a housing preference survey? Probably never. If you want one, I got one. We did one down in Collier County. The results were phenomenal. So you ask people, where do they want to live? With that, I think I'm going to turn it over to the panel because what you have here is a lot of traction right now. You got a lot of traction by the city, the county. I follow the news down here. I follow the homeless issues here. I've seen the changes. I've seen your proposals. But anyhow, I think you've finally got some pretty good traction. So Scott and Ed and Wayne, or do you want to introduce them? Yeah.
Thank you, Mark, and thank you for being such a resource for us. So I'm going to introduce the panelists now, and I made some friends along the way that are really, really amazing. And one of my most favorite friends is Scott Eller, right here. Scott Eller cracks me up, and we speak the same language. And I love how he just does the job, and he gets it done. And it is a challenge. But when it comes to providing affordable housing for people, he is a dynamic person in his niche of the world, which is to do it from a private vantage point, not necessarily using the public, although we're creating partnerships and giving opportunities to those individuals who need them. I know how passionate he is. I get his emails about certain people, and he wants to keep me in the loop. And he doesn't take no for an answer, and that's what I adore about Scott. So please welcome Scott. Oh, and maybe you want to know in case you don't know him, he is the CEO of Community Assisted and Supported Living, and he currently serves 600 clients who have low incomes in Manatee, Sarasota, Charlotte, Lee, Collier, and more, which we will probably hear about that are forthcoming. So that is a great, great asset. Another one of my friends I've made along the way, although we first met over 10 years ago when we were starting DUI court. I was court counsel then, and Judge Dinkin had asked me to help write the grant. So that's how I met Wayne. And Wayne knows what he's doing. He is an absolute huge resource. He sees the big picture. His official title is the Director of Homeless Services, and he has had that title since 2013. But he really knows a lot about this community, and he also gets the job done. So welcome to Wayne. And my newest friend, who I can tell I'm going to like very much, is the newly directed CEO of the Suncoast Partnership to End Homelessness. So I know that he's already made significant progress. He created, what was the name of the program that you created that you got people to get to the event?
Oh, the one-by-one coordinated entry.
One-by-one coordinated entry. And this is funny, it didn't actually exist, but he thought if he gave it a name, people would come, and now it does exist. So I thought that was pretty creative. All right, so I'm going to turn it back over to Mark for the panel.
Okay. Yeah. Son? Yeah. I'll do it from here. I really don't have to do much moderation on this because these guys can speak for themselves. But the way I want to frame this for the three of them is that what the public sometimes misses is what is permanent supportive housing, okay? Permanent supportive housing is housing and services. A lot of times the public misses the services piece, and they don't understand the importance of the wraparound. So all I'm really going to do is kind of frame this and kind of have you guys give an update of your progress, but please address both the housing side and the services side.
I think I was selected to go first. First, thank you very much, Judge Quartermain, for having me. I want to, on behalf of the County Commission, thank you for all of your work here and all of the nonprofits and the service providers in the room who do the work every day. The County Commission has had a long standing of support in supporting recovery and treatment programs. You all probably know that the county is one of only like 4 counties that have an addiction receiving facility, a 24/7 facility for Marchman Acts. Obviously, the county has been behind the VIPER program as well. So there's been a number of initiatives that the county has invested in. Annually, about $10 million is provided to my office to provide funding to service providers in the community in the human services arena. There are 9 different systems. However, 52% of that funding goes to the behavioral health, mental health, substance abuse world. So it is the #1 utilization of the funding that we have. So there's a huge commitment to fund initiatives such as even the example in Miami-Dade that Judge Leifman presented. The County Commission recently asked the stakeholders of both criminal justice and behavioral health to come together and identify recommendations for the Board of County Commissioners on how to prevent unnecessary incarceration. And so there's a work group that's out currently working on that. So we're very much, as a county, wanting to look to the experts that are in the room to decide where we should go next. Obviously, Mark talked a lot about very narrowly focused population and permanent supportive housing. I wanted to step back just for a moment to talk about a homeless crisis response system. And in Sarasota, if you've been around for the last 5 years, you've heard a lot of conversation about homelessness, and didn't seem like a lot of progress was moving forward. Having sit here today, I would say that was a process that our community needed to go through in order to get somewhere. As frustrating as it was at times, it was a necessary process. Last year, city, county, foundations, and our community all endorsed this plan here. And I'm very optimistic about the plan because you saw earlier today in the video from Carl talking about how he had been in his situation for decades, but at some moment in his life he decided he was ready to make a change. This system and this model is hoping that the system is there when people like Carl decide to make a change, the system is immediately ready to respond. It's also designed to on that premise that people who are in recovery, whether that's mental health, substance abuse, or physical ailment, do so better at home, not on the street. So the system that was endorsed has been what I would say is still, to use probably a bad analogy, we're still in the pregnancy stage. We're still developing this baby. It's at different stages as you look, but there is movement moving forward on a regular basis. Ed's office is handling coordinated entry. This is really where, for the first time, all of our community resources are going to be coordinated in one place through a coordinated entry system. So that means whether you go to JFCS or you're in a camp with a social worker and a laptop, you're going to be provided the same assessment, the same housing priority, the same instrument in order to align you with the resources in the community. Some people will be able to go directly from where they're at to that housing resource. Some people may need a stop at an emergency shelter waiting for that housing placement. Hence, the city and the county have come together based upon the report, have contracted for 50 beds at the Salvation Army for those, we call them hotbeds, for that stage of the process. Obviously, rapid rehousing is a part of the component. A large number of people will be eligible for that based upon that scoring mechanism. You probably saw recently, thanks to the great work of Gulf Coast Community Foundation and Community Foundation of Sarasota and some of their donors, collaborative of donors come together and have invested, $1.5 million in providing 100 new units of rapid rehousing in the upcoming year, and have contracted with St. Vincent de Paul of Pinellas to supplement the resources in our community to develop that model. The last piece is permanent supportive housing. And I won't spend too much time on that because I don't want to steal Scott or Ed's thunder on that, but Scott's going to probably talk with you about Arbor Village and a new project we have. So each one of these bullets in here have had enormous movement just since the commissions accepted this report last April. It's been enormous movement if you've been watching it. I'm very excited to see where we'll be a year from now. I must thank the city staff, the city commission, foundations, and my county commission to really allow us as a group of staff folks to work on this. We were given the space and the safety net to try to develop a plan for our community. And I think we have a great plan, and I'm looking forward to what the results are going to be after we actually have the baby and are running the system. So with that, I think I'll turn it over to Ed to talk a little bit more.
Okay. If you could, everyone please stand up a second. It was lunch. We need to stretch for a second. All right. If you have been in your job, the job you have now, for more than 3 years, sit down. All right. If you have been in your job for between 1 and 3 years, the job you have now, sit down. Okay. So even though all of you need this day, if we only had enough vouchers for training for about 20 people, you that are standing up would probably be the ones that would get the training. And the rest of you, well, you hope they come back with good handwritten notes. Go on and sit down. The point of that little exercise is that when you deal with the realities of limited dollars in a community, this year, we started off this year looking at, from now until September, we were only going to have like 85 open rapid rehousing and permanent supportive housing spots open, period. And yet we had 2,700 people in households who were homeless provided services since September 30th. So 2,700 households who were homeless were provided services during that time, and we had enough funding with rapid rehousing, and I'm talking about rapid rehousing with supportive services and wraparound services on the back end to help 85. And now, because of the generosity of private donors, we can look at a number closer to 165. And next year, with the addition of some additional permanent supportive housing and some additional monies in that other pool, we'll be looking at 245. But we still have, so when I say that we're getting traction, we're gaining traction. We're demanding higher standards. We're demanding that people be assisted in every aspect. When we do our RFP this year, instead of every time we get a grant, we go out and ask people to please apply for this grant. This year we're saying we're doing one RFP for all the grants that come through our office, and we expect you to respond with your best ideas, with the best proven practices, and coordinate and make sure that if your DNA for your organization is case management, and you really aren't housing people, that's not what you do, then find someone who does that, and the two of you group together and come in with a proposal so that we have some real solutions with higher effectiveness, higher degrees of success. We're going to accomplish that this year, and we're going to try to make that 245 into 345 over the next 12 months, And it won't solve our problem of homelessness, but we'll begin to do something other than tread water. Because what we've done over the last few years is, I can point that we had 700 people last year who we assisted, or they took part in services and later found housing. So a lot of those were able to self-resolve. And we'll probably have a similar number this year, but I'm hoping it's 1,000 instead of the 700. So we're not treading water, we're making progress. That's my hope. And we do that because of the people in here. And on behalf of the 24 organizations in Sarasota and Manatee County who are part of the continuum of care, and the 70 persons who are on our continuum of care, and the 21 city community leaders who sit on our leadership council and help give us direction, we really appreciate the opportunity to be here and talk with all of you. And as always, if you ever just want to talk about homelessness, clearly you know that I'm the one. I'll talk as long as you want. Turn it over to Scott.
To give you a little history, Castle was founded in 1998, and in 1999 we began business with a 38-bed licensed assisted living facility with a limited mental health license. And I remember telling my wife at the time, all we need is about 50 beds to really make this thing work and meet the needs. And so we reached 50 beds the following year, and I said, well, let's try 100 beds to see if we could start meeting the needs. So we went for 100 beds. And that's around the time I met Mark, and back in those days I was a big ALF guy, and I really wasn't embracing the scattered site housing, but I did something rather unique to me. I started listening to other people versus myself, and to find out what they need. Because as we know in business, and if it's a not-for-profit or for-profit, it's still a business, and that is the customer is the person sitting across from you, and they're always right. And so if you want to stay in business, you give the customer what they want, and then you provide for them what they need in order to succeed. And so with that, we started with a couple quadplexes, and as the story goes, nowadays we have the licensed ALF that we're now converting to a new licensure program that I'm trying to push through the state with. And we have over 140 different scattered site properties throughout 5 counties in Southwest Florida. And with that, we have single-family homes, condominiums, duplexes, triplexes, quadplexes, cluster housing. And we now have, with the joint venture of Loveland Center, the Loveland Village, which is a planned residential community for people with a developmental disability. And what was interesting is we have 94 beds down there, and it took us about a week to fill it. And that's pretty much par for the course in what we're doing. Every time we buy a house, build a house, within a day or so, it's full. And so with that, we realized the tremendous need for what we're doing. And to segue into some data, because I love to share it, in 2007 in Lee County, they did a study for people that were living on park benches and homeless encampments, and they were consuming $87,000 a year in acute care services. People living in independent housing without the supports, as Mark referenced, $52,000 a year in acute care services. They took people in a Castle permanent supportive housing program, and these were people that originally lived on park benches, $5,000 a year in acute care services. So just to do the wraparound support saves $47,000. Now, if that's not interesting, a program that Wayne Appleby created called the Shifts program, we took in 111 people in 18 months. Of the 111 people that we took in randomly, 93 had a disability. So we're pretty much on track for 85-90% of those folks that are homeless have some sort of disabling condition. A majority of the people we brought in were co-occurring where they had a mental health issue and an addiction issue or substance abuse issue. What was interesting is the 18 months before they moved into our program, there were 667 arrests and 875 charges, I believe. Post 18 months, 3 arrests, 0 charges. So if you average the cost of an arrest at about $2,000, that means with something that Wayne created, saved the taxpayers $1,328,000 for approximately a $350,000 investment with Castle to do our part of it. So with all that, we saw this compelling data, which then we see Judge Quartermain doing an innovative program with CTC and all the other pieces that are coming along with it. For example, Arbor Village. Last year, we joint ventured with a group called Blue Sky Communities out of Tampa. And we put in for the tax credit application, and we were awarded about $19.5 million in funding, of which $15 million is tax credits, $3.5 million is sale money, and about $1 million is called ELI money, or extremely low income. In Arbor Village, which goes in front of the planning board tomorrow, everybody keep your fingers crossed. As long as we get through, we will be going into permitting to build 80 new apartments. 72 of those apartments will be 1 bedroom, 1 bath, and 8 of the apartments will be 2 bedroom, 2 bath, and we're expecting the rents to be as low as about $200 a month. So that makes it affordable. And this is right off of Tuttle and Fruitville Road. So it's not like we're putting people out in the middle of nowhere. They're still going to be part of the community. But along with this, we're building a 10,000 square foot office building. And we're moving our supportive housing team there, as well as we're going to be inviting providers to, at a discounted rate, to be tenants or neighbors of ours, with the hope and idea that when people come to us, we can assess them right at the offices, find out what their needs are as we're triaging them right into a unit. And so with that, we do hope that we plan to open in June of 2019. So with that, I think we'll open for questions. Mark?
Let me frame another one. So I'm going to ask another before we get questions. So Scott, you've had some real experience with scattered site housing, right? And here's where I'm framing this is, if you're not aware of the Olmsted decision, and I know Sarasota County had an issue years ago, the Olmsted decision is really about community integration, that people are not housed in large buildings who all have the same disability. Okay, so I'm just kind of curious. Some of the new projects that have come online, the big ones, are mixed income housing. Yes. Is that what your plan is? And tell us more of your success on the scattered site.
Well, on the Arbor Village, we're expecting about 60 of the units to be for extremely low income, and about 20 of those units will be for people that are just lower income individuals. But the reason we're incorporating social services into the model is we have to be aware that when people come in the door, they might need some form of help, whatever it is. So, but it is going to be a mixed use, but again, a priority is going to be is the people that we see in downtown Sarasota, and we all see them, let's give them a place to live, is the idea. On the scattered site, the biggest problem we're having is that we're finding more people than not don't want to leave. Sure. Because they get into a unit, and they're living in middle-class America. The home looks like another home in the neighborhood, and we're not seeing people survive, we're seeing people thrive. And so that's really the success story. And another one that's very compelling is less than 5% of the people that we're serving are Baker acted. And in the past 17 years, we've had one return to state hospital, and even that person returned to us after a 6-month stay in the state hospital.
That's great. I've got a question for Ed. Ed, rapid rehousing, okay? I mean, basically it was an outgrowth of the housing first approach, meaning getting people into housing as soon as possible and then wrapping services around them. The problem with rapid rehousing, and I'm sure you got a plan for it, but rapid rehousing, the rent subsidies run out after a certain period of time.
Right.
So what's the situation here? You've got a fantastic donation.
Yeah, there is that reality. And we also have the reality, as all of you know, affordable housing is a difficult problem in Sarasota County, probably as difficult as anywhere in the state because of our economy, especially in Sarasota County. However, we look at making sure that the persons that we're working with, that whoever's working with them evaluates their income as well as their acuity of need to assure that those that go to rapid rehousing with some assistance and income enhancement over the period of the time, and without a limit of some artificial limit of 3 months or 2 months of housing assistance, allowing it to go up to 12 months to 2 years to allow a person to become more sustainable on their own, is one way we're going to address it. The other way we're going to address it is that those persons who we know coming in the door have fixed income and are not going to be able to afford into rapid rehousing. We prioritize those persons for permanent supportive housing instead in scattered sites and in new models, for example, master leasing and other models like that, which allow the leasor to take on a group of properties and then pay the lease total amount to the whoever owns the property, and the persons who live there pay a lesser amount over their period of time. So we have strategies out there. Can't say they're all firmly filled out, but we're hoping that with the RFP, people will come in creative and give us some of those ideas back.
Okay. Another question about Shelter Plus Care. And I don't know how many units you have in Shelter Plus Care. Shelter Plus Care is a voucher program, but it comes with one string attached, and that one string attached is the services. You've got to have the services in order to receive the vouchers. So how does that work in Sarasota County?
Well, we were just awarded with Ed, was it $71,000. So it's about 40% of what we need or projecting for Arbor Village for the rental subsidies. It's really more like a project-based voucher system where the dollar is for the rental unit that we provide. But the difference with Shelter Plus Care, and the Plus Care is the big portion of it, is that dollar for dollar, we have to match whatever the feds give us in rental subsidy with services. So what the feds are saying is we're going to give you this dollar, but we want to make sure that the people that you're providing this to, that you're providing them services through a different source and that's what we're doing.
Now, Scott, are you the primary provider of Shelter Plus Care, or are there other providers in the room?
Well, we're going to be working with other providers as well. We do this in Lee County right now. We've been doing it for 13 years. Okay. And in Lee County, we work with Coastal Behavior Healthcare with their FACT team, and we're working with Salus Care. So in Sarasota, we project to be working with private providers, Coastal Behavior Healthcare First Step, and Centerstone.
Okay. And let me ask you a substance abuse question, because this comes up all the time.
It's not true. I don't care what they say.
No? If, the lay of the land is that in the area of substance abuse, you don't provide treatment on site unless you have a license. So could you share with the audience how that happens?
Well, it's something as Mark pointed out. What Castle is Castle is a housing provider. We do what's called supportive housing, where we have caseworkers go out into the homes and help people live life, balance their checkbooks, get the doctors, advocate for services and treatment. But we do not provide the treatment. The second you provide the treatment, as Mark, we become an IMD, which is against federal law, which stands for Institute for the Mentally Disabled or Mentally Diseased. So we heavily rely on providers to provide the treatment services that the individual is willing to accept. But those services are provided by specialized groups, like I said, Coastal, First Step, Centerstone, Vincent Academy.
Okay. And do any of you three have a vision for home ownership for this population?
We have considered, and we've talked to Brad Baker with the local land trust to see if we could merge with them or joint venture with them, because that would be an entertaining thought. We are doing another project with Bob and Diane Roskamp. And what I'm hoping to see come out of that is to create what's called like a life estate, where we could build like a 4-bedroom house. Sure. And each bedroom is its own little apartment suite, right, and that the people can invest and buy into that apartment suite at a reduced rate.
One other item on that. There's a group, and I know that the Geyers are involved in this, that have been meeting on permanent supportive housing with David Clapp from the Central Florida. And there has been discussion there about land trusts and other kinds of vehicles that might put us there. But to be really honest with you, we are right now concerned about finding affordable rental units. Right. Because when I look at my staff of 11 and only 3 or 4 of them can afford to live in Sarasota County, then it becomes a pretty tough issue to look at home ownership. Okay.
Just want to keep the vision out there. That's all.
I'm just trying to keep it real.
I'm with you. I did housing for 13 years. No, it is.
Just really quick, we do have a model that we're working on. It's about an 800 square foot unit, and we are building one right now that we're experimenting with that we see bringing online for $55,000. If we can bring it on for that, it could be affordable for home ownership on a 30-year mortgage.
Good. That's great. Okay, well, we've got about 3 minutes. Are there any burning questions from the audience at all that you all are curious about? Joan?
Are there any tax incentives?
Actually, yeah. Scott, you can speak to the tax credits.
I think you're referring to like a social impact bond.
Yeah.
A social impact bond is sort of like a tax credit in reverse. In tax credit financing, the feds award tax credits to the state. The state then award them to local groups like myself and Blue Sky. And then we work with an investment brokerage house. In our case, it's Raymond James, who then will sell the tax credits. In this case, it's for 10 years. It's $1.5 million for 10 years to private enterprise, and then private enterprise can use that as a discount on their tax obligation to the feds. A social impact bond is where you get the dollars directly from an investor, and it comes with certain outcomes and caveats to it. And then, as long as you meet those outcomes, then the feds will then come back and reinvest in it, and then the investor gets their funds back.
There really aren't, though, for individual landlords,
Yeah, that's right.
tax credits. I will tell you one thing about individual landlords. One of our pregnant issues is, to use Wayne's words, over the next year, we hope to create a contingency fund for landlords that will allow landlords who work with us and with those who have disabilities, mental health issues, mental illness issues, substance abuse issues, but will work with us on renting and housing. But they will be able to apply to a contingency fund should there be property damage or any other substantive loss. And that's a way to both create greater relationships with landlords and keep them in the fold as we move forward.
Something else to keep in mind, both the Suncoast Partnership and Castle are not-for-profits, so when donors do provide funds to us, they are tax deductible.
And a lot of these models are written up, okay? The Florida Housing Finance Corporation has free technical assistance to communities. The SAMHSA toolkit speaks to tax credits, as well as some of the contingency funding. The landlord piece is in the Pathways to Housing First model. So there's resources out there for anybody who needs them, okay? So
I just wanted to share, if you have an interest in the plan and reading the more detailed level of the plan that our community is implementing now, this is available. It's on the county website, but there's 7 steps to get to it, so I'm not going to tell you that. You go to the suncoastpartnership.org, suncoastpartnership.org, and right under the pictures that come up is a link to the report. And you can find the whole report. Page 28, 29 are actually the abbreviated recommendations, and that's really what all of us have been working to implement, over the last year or so.
let's give these guys a round of applause.